The first Carolina curriculum was published in 1986 under the title The Carolina Curriculum for Handicapped Infants and Toddlers. The second and third editions were published in 1991 and 2004 under the title The Carolina Curriculum for Infants and Toddlers with Special Needs. All three versions of the curriculum share the same general characteristics. They are based on normal developmental milestones, but do not make an assumption of even development within or across domain. Thus, a child with a severe motor impairment but normal cognitive capability can progress through the cognitive portions of the curriculum with modifications to accommodate motor limitations. The authors are committed to a transdisciplinary approach in infant intervention. That is, all disciplines concerned with a child's development share information freely and encourage each other to develop and use cross-discipline skills. The curriculum is written so that parents and teachers, as well as interventionists, can understand it. It is the aim of the authors to include parents and other caregivers in every phase of an intervention program, from participating in the assessment to selecting the skills that will be the focus of intervention to implementing the intervention. The curriculum focuses primarily on children with mild to moderate impairments, although it has been used successfully with those who have severe to profound limitations. Fewer modifications are needed for those with mild to moderate impairments. The observations and theory of Jean Piaget strongly influenced the selection of many of the items in the cognitive portions of the curriculum. The teaching methods suggested in the curriculum come from behavioral learning theory, especially the ideas of reinforcing learning through consistent consequences, shaping skills by reinforcing successive approximations, and providing practice in a variety of settings. Items are arranged in increasing chronological age within each curriculum sequence for ease of administration. Some disabling conditions make it difficult or impossible for a child to master skills in the same way that a typically developing child may master them. These children will need alternatives for developing adaptive skills. For example, a child with significant cerebral palsy may not be able to demonstrate object permanence by removing covers from objects, but may be able to indicate location by pointing or by eye gaze. Many children with Down syndrome or who are on the autism spectrum may be slow to say words and may progress more quickly if allowed to use manual signs or pictures to communicate. Items are criterion referenced so as to determine when a child has mastered each skill. Refer to the criterion statement to determine when the skill item has been fully met. The third edition of the CCITSN covers the age range from birth to 3 years. The Carolina Curriculum for Preschoolers with Special Needs, or CCPSN, covers the age range of 2 to 5 years. There is 1 year that overlaps between the two instruments, with matching curriculum sequences for the age span from 24 to 36 months. The third edition of the CCITSN rearranged the cognition sequences according to current theory and research. Specifically, the items from the 3 object permanence sequences have been integrated into 2 attention and memory sequences, one focusing on auditory and the other on visual skills. The third edition also includes more attention to early literacy, music, and play. There are chapters describing the importance of these areas, and items addressing them are included in the teaching sequences. There also is an emphasis on the importance of practicing skills in typical day-to-day situations and for using skills for various functions in the environment. In addition to the printed versions, blank assessment logs are available for purchase on CD. The CCITSN is appropriate for those in-home or center-based intervention programs for children aged birth to 3 years. The CCITSN is intended to be used in the following ways. First, to assess a child's current skills. Second, to plan and implement an intervention program based on the child's strengths and needs. And third, to provide for systematic reassessment so that change can be documented and intervention plans updated. There are 3 major components of the CCITSN which will be reviewed in this course. The manual, assessment log, and developmental progress chart each will be presented in detail. The manual is a complete curriculum. It consists of several introductory chapters, examples of the assessment log and progress chart, descriptions of how to teach each of the skills included in the curriculum, and appendices. The early chapters of the manual are informational chapters providing an introduction that describes the background and philosophy of the curriculum, as well as the new checklist for emergent literacy skills. Turn to page 12 now and review the checklist. Note the 3 sections of literacy, including print and book awareness, metalinguistic awareness, and oral language. Note the source of the checklist items at the bottom of the page. Not all items listed are included in the curriculum sequences. They are provided to guide your literacy interventions with your children. Chapter 2 includes suggestions for encouraging optimal learning in young children, such as including play, offering choices, following the child's lead, and making consequences count. It is a helpful resource for families and early care workers alike. Chapter 3 includes descriptions of environmental factors influencing learning, development, and emergent literacy. It includes suggestions for preparing the physical environment, enriching the environment through music and movement, and using the environment to promote emergent literacy, and is a helpful resource for enriching environments. Chapter 4 includes all instructions for administering the curriculum with case examples. This will be reviewed in greater detail in a later section of this course. Take some time now to look through chapters 1 through 3 in more detail. The appendices provide supplemental and helpful information to guide your interventions. Appendix A lists some impairments and their effects on development. Appendix B lists recommended readings for further information. Appendix C lists practical play suggestions and modifications for children with motor impairments. Appendix D lists examples of communication systems for children with motor impairments. Appendix E includes detailed pictures of motor positions and milestones for very young children. Take time to review each appendix now. The authors of the CCITSN have put some cognitive and communication items into a section that combines these skills. The skills in this section are ones in which cognition and communication are closely aligned and cannot be separated into their own domains. Please note that the numbers assigned to various sequences do not indicate their importance.